Dr. Carlos Peñaherrera. I am an endocrinologist and I work at Hamilton's Diabetes and Endocrinology Center. So the endocrinologist is a physician that takes care of all of the hormonal issues in the body, and also much more commonly all that is related with diabetes. Either if you're a type 1 diabetic or a type 2 diabetic and you need help with controlling your blood sugar and preventing all the complications that can come from it, you can see the endocrinologist for it. I grew up in Ecuador, in a city called Guayaquil. So I decided to be a doctor from a very early age. I think my parents being physicians had a big impact on it. And when I was in high school, I was going with my dad to the hospital. He started teaching me some things from his specialty, and I really enjoyed it. So I decided that that's what I wanted to do for the rest of my life, just doing medicine. I moved to the US after finishing my medical school to do residency. I did my internal medicine residency in Morristown, New Jersey, and then I did my fellowship in the University of Miami and Jackson Memorial Hospital in endocrinology, diabetes, and metabolism. I actually got to train in 3 different sites during my fellowship. I was list number 1, the Jackson Memorial System, which is a big community hospital which gets all cases from the area. Then I also got a chance to work with the veterans in the VA, in the Veteran Administration Hospital. And then I also got a taste of the private practice and also see a little bit a more complex management of endocrine diseases with the resources that you have. It's just my wife and me and our baby. We like the quietness and the peace of a small town setting. And I got in touch with the people at Hamilton, and they told me about all the great things that they're doing here and the need that there is for care in endocrinology and diabetes, especially for the Hispanic population. You can be explaining to somebody who doesn't really understand English that much. You can be explaining them for hours how important it is and what they should do, but they only take home like a portion of the message. So it's important to get on the same level and earn that confidence, earn that trust, and the best way to do it is do it in their native language. My job is a shared job with the patient. It's 50% me and 50% the patient also has to play a role. And as long as we come up with a plan together and that works and we see that it's working, that is very rewarding to me. So I would say the practice of endocrinology is mostly, I would say 50% focused on diabetes, and then the other 30% will be thyroid problems, and that extra 20% is everything else. Besides diabetes, which is the most common endocrinological problem and one of the most prevalent diseases in the world, you can have problems, for example, with your thyroid gland, and the problems with your pituitary gland. Then you can have problems with your adrenal glands. It's very broad, but we specialize in treating every single disorder that can arise. Anywhere where I can be with my family and have a good time, as long as we go together. So that's the most important part of me. It's not as much that the destination as it is who you are with. Soy el Dr. Carlos Peñaherrera, soy endocrinólogo y trabajo en el Centro de Endocrinología y Diabetes de Hamilton Medical Center.